Hello everyone, welcome to our channel Doctors to Be, and this is the part 2 of internal capsule where we will discuss about the fibers of the internal capsule. And if you have not watched our part 1 on internal capsule, please consider watching that video, because in that video we have discussed about the features of internal capsule, boundaries, shape, and we have explained about the boundaries and shape and its parts of the internal capsule. So in this video we shall discuss about the fibers of the internal capsule, and link of the part 1 of internal capsule will be in the I button, so consider watching that for continuity on the topic. So let's get started with the fibers. So fibers, as I told in the previous video, there are two types of fibers: motor fibers and sensory fibers. So motor and sensory fibers. Okay, so motor fibers are also known as descending fibers and sensory fibers are known as ascending fibers. Okay, so motor fibers, also known as descending or cortico fugal. So you have studied in a physics centripetal force, that is towards the center, centrifugal away from the central, away from the center. Same logic over here. Descending means it is going away from corticofugal means going away from the cerebral cortex. It is obvious the motor fibers supply to the impulses to the effector organs. So with effector organs like skeletal muscles, so we can they can take the actions. So it is running away from the cortex, so corticofugal. On the other hand, sensory fibers are also known as ascending fibers, or they must be corticopital. So corticofugal, corticopital, they so you don't get confused when they are saying corticofugal fibers. Okay, so they are the motor fibers. So now let's first discuss about the motor fibers of the internal capsule. So motor fibers. So we have, under motor fibers we have cortico-pontine fibers. Okay, cortico-pontine fibers, pyramidal fibers and extrapyramidal fibers. Okay, so let's start about them. First one is cortico-pontine fibers. Okay, so they are again divided into following. That is, first is frontopontine, okay, this frontopontine is present, PRES is present in anterior limb, posterior limb and genu. Okay, it is present in three parts: anterior limb, posterior limb and genu. So these are the anterior limb are parts of the internal capsule. We have already discussed in the previous video. Okay, so then the second one is the parieto and occipito. Pontine. Okay, parieto and occipito pontine fibers, and these both occipito and parieto pontine are present in retrolentiform part. Okay, retrolentiform present in retrolentiform part. Okay, then we have temporopontine. And this is present in the sublentiform part. Okay, in sublentiform part. Sublentiform part. Okay, and one important feature about the corticopontine fibers are these corticopontine fibers also form the corticopontocerebellar pathway. So if we have already studied about the brainstem, or then you'll understand about the corticopontine cerebellar fibers. If not, we'll discuss about the brainstem in our upcoming videos. For now, you should remember that when we have a section in the brainstem, in the medulla, we have pyramids. Okay, the pyramids are a bundle of fibers, and these fibers consist of three sets of fibers. They are corticopontine fiber, corticospinal fiber, and corticonuclear fiber. Okay, corticonuclear fiber and corticospinal fiber, these are also the pyramidal fibers of the internal capsule. Okay, so these three set of fibers, corticospinal, corticopontine, and corticonuclear, these fibers run from the cerebral cortex. Okay, they run from the cerebral cortex, and they run through the cerebellar peduncle of the midbrain, through the pons, and reach the medulla. Okay, but the corticopontine fibers, they, at the level of pons, the corticopontine fibers, they relay to the pontine nucleus, and then go to the opposite side of this to go to the opposite cerebellar hemisphere. Cerebellar, okay, I am not saying cerebral, cerebellar hemisphere. So the corticopontine fibers at the level of pons, they are going to the cerebellar hemisphere, opposite cerebellar hemisphere, through middle cerebral peduncle, and this pathway, okay, this pathway is forming the corticopontocerebellar pathway. So we'll discuss in detail about this. Don't get worried, don't panic. For now, just remember that three sets of fiber, one is corticopontine, corticonuclear, and corticospinal. We'll discuss about them. They are the pyramidal fibers. These three set of fibers form the pyramid. Okay, these three set of fibers run from the cerebral cortex through the pons to the pyramids of the medulla. Okay, and at the level of pons, the corticopontine fibers, they transverse. Okay, these are the these all three set of fibers, they run longitudinally. Okay, and at the level of pons, the corticopontine fiber will relay to the pontine nucleus and go to the opposite cerebellum. Okay, so it is forming the, from, they are coming from the cerebral cortex, no, so it is forming corticopontocerebellar. Now it is going to the cerebellum, so it is cerebellar pathway. Okay, cerebellar pathway, so which forms corticopontine at the level of pons. Remember this much. We'll discuss about these pyramids at while discussing about the midbrain. For now, we can write they form corticopontocerebellar pathway. Okay, those who have already studied, or those who know about the midbrain, they'll get it easily. But don't worry, those who have not studied will also learn about the midbrain in the upcoming videos, and they will find it easy. Okay, so if this is the cerebral cortex, okay, then the fibers, the three set of fibers come. But for now I am drawing only corticopontine fibers. Okay, the corticopontine fibers come, they relay to the pontine nucleus. There is in the section, while the section of doing the section of the pons, there are two parts, tegmental part and the basilar part. In the basilar part you find a pontine nucleus, they are gray matter, so they relate to the pontine nucleus and then they go to the opposite cerebellar cortex. Okay, so this is the cerebral cortex and this is cerebellar cortex. Okay, cerebellar cortex, don't get confused with cerebral and cerebellar. Okay, cortex, and this is the cerebral cortex. So I don't have place, so I am not writing it. Cerebral cortex, and this is the pontine nucleus. Okay, pontine nucleus. So for now, just remember the corticopontine fibers form the corticopontocerebellar pathway, and we'll discuss about these in detail about while discussing about the midbrain. Now let's come to the pyramidal fibers. First was corticopontine fiber under motor fiber. Now second is the pyramidal fibers. So they have cortico nuclear, or it is also called corticobulbar. So corticonuclear, and so corticonuclear, it is present in the zenu, and it is a motor fiber, so takes impulse to supply impulse to head and neck. Okay, why I have written this? Because this will help us to understand the clinicals. Okay, head and neck supplies impulse to the head and neck. The next pyramidal fiber is corticospinal. Okay, this is present in the posterior limb, and supply to upper limb, thorax, trunk, upper limb, trunk, not thorax, upper limb, trunk and lower limb. And it is present in the corticospinal, is present in the posterior limb. Okay, now let's talk about the extrapyramidal fibers. So rubral, these are present in the posterior limb. Okay, then we have corticostriate, and the other one is corticonigral. These are the extrapyramidal fibers, and among the pyramidal fibers are the corticonuclear and corticospinal, present in the zenu, and the corticonuclear present in the zenu, supplying impulse to the head and neck, while the corticospinal present in the posterior limb and supplying impulse to the upper limb, trunk and the lower limb. Okay, so these are the motor fibers. After this we shall discuss about the sensory fibers and then draw a figure showing the location of these fibers. Okay, now sensory fibers. So sensory fibers are the thalamocortico fibers. Okay, they are thalamocortico fibers and of 4 types. Okay, so we call the sensory fibers, we also write them as radiations. So this term, I'll use this term radiation in the following, in the names of the following five sensory fibers as anterior thalamic radiation. Okay, I'll use that radiation because radiation can also be used for sensory fibers. So they are the Thalamo Cortico fibers and are of 4 types. So let's discuss about them. First one is the anterior thalamic radiation. Okay, first one is anterior thalamic radiation. So anterior thalamic radiation is present in the name denotes the anterior thalamic radiation. Anterior is present in the anterior limb. Okay. Then we have second one, superior. Okay, superior thalamic radiation. Okay, superior thalamic radiation. This is present in the genu and posterior limb. So the location does not match with the name. So superior thalamic radiation. Then we have posterior thalamic radiation. Okay, posterior thalamic radiation and inferior thalamic radiation. So inferior it is present in sublentiform. Okay, sublentiform part, and inferior thalamic radiation is also known as auditory radiation. Okay, and we did not write about the posterior thalamic radiation. Posterior thalamic radiation in retrolentiform. Okay, retrolentiform part, and this is also known as optic radiation. Okay, posterior thalamic radiation is known as optic radiation. So how to remember which one is optic, which one is auditory, so that we don't get confused? P for posterior, yes or no? P posterior thalamic radiation, and optic we have P optic radiation. So P posterior thalamic radiation is also known as optic radiation, and inferior thalamic radiation is auditory radiation present in the sublentiform part. Okay, so now we shall draw a figure which will locate, through which we can locate these fibers. Okay, so let's draw the internal capsule once again, as we have already seen it in the previous video, part 1. So let's draw it once again, which will also help in the practice and to locate the fibers. So we have lentiform nucleus on the lateral side. Okay, this is medial and this is lateral. Okay, concavity lateral side with lentiform nucleus and cleostrum. Okay, and this is the bent part is known as genu. So I note it so that you know we can locate the fibers for the location. And this is caudate nucleus, as we all know. This is the thalamus. So T for thalamus, C for caudate nucleus. This is cleostrum. So now let's get let's now locate the fibers. Okay, thalamus, and this is the retrolentiform part. So these dots I am doing, these are showing the fibers. Okay, these are showing the these are the bond, as we told, internal capsule is the bundle of projection fibers. So this is the horizontal section, no? So these are the fibers coming upward. Okay, these dots, they are a bundle of fibers coming upward. This is the horizontal section, yes or no? So now let's look at the other fibers. So first let's look at the sensory ones. On sensory we had anterior thalamic radiation. So anterior thalamic radiation present in the anterior limb, yes or no? So this here shows the, this is the anterior thalamic radiation, and we also had the frontopontine fiber. Okay, so this we'll level those. They are also present in the anterior limb. Then we are discussing superior thalamic radiation. Superior thalamic radiation present in the genu and posterior limb, yes or no? So present in the genu and the posterior limb, genu and posterior limb. Okay, so this is the genu, the bend, and this is posterior limb. Okay, let's make it a bit short so that we can look at the other fibers. Okay, this is the superior one, superior thalamic radiation, and then we had other two. They were the posterior and inferior thalamic radiation. The posterior was also known as the optic radiation, and the inferior one also known as the auditory radiation. Okay, so one thing I forgot to mention while mentioning about the optic radiation and or the posterior thalamic radiation and inferior radiation. So I'd like to mention it over here. The optic radiation. Okay, optic radiation you can include in the points if you have space. Optic radiation arises from lateral geniculate body. Okay, while the auditory, it arises from the medial geniculate body. Okay,